According to the CDC, nearly 800,000 Americans have a heart attack each year, for an average of about one heart attack every 40 seconds. As a result, the need for cardiovascular surgeries have become increasingly common. But what happens afterward? Dr. Roy Robertson explains that the recovery period is just as important as the procedure itself.
Technical nature and the expertise of the physicians is utmost important in getting through a procedure, but the human body needs some special attention to recover. So we offer a wide spectrum of opportunities for patients after procedures for recovery. One of those is cardiac rehabilitation, where we actually monitor patients with exercise and in the resting state and through different types of exercise to see how their body's responding to the treatment that they received. We also do careful history and physical examinations afterwards to pay attention to a lot of smaller details. How is the heart itself recovering? How's the body recovering? And mentally, how are people recovering?
While a post-cardiovascular surgery patient must take care of their body after a procedure, depression can be a major setback.
Being ill does generate what we describe as situational depression. That being an appropriate depression in the circumstance of a challenging time, and that can be physical or mental. It can be the death of a family member, a loss of a job, or a physical illness. But beyond that, there are actual physiologic changes that do occur with people when they have physiologic illness that can spur a change in mentation. And that can lead to challenges in how we process information.
Dr. Roy Robertson says that typically patients are sent home when they are able to proceed with self-care activities like getting dressed, eating, and sleeping. But what about those whose recoveries are more difficult?
We would anticipate once you go home, there's a few days, a few weeks of lag period where it takes a while to recover from these procedures. And we recognize that that's going to happen. But what we don't like and what we don't understand is a change in the way people feel such that they're feeling worse in any direction. Short of breath, more chest discomfort, difficulties with energy, difficulties with their medications. They may have some side effects from the medications, or they may have a change in the way they feel overall. The important part there to understand is that because you're being discharged from the hospital on day 4 or day 2 or day 7, that does not mean that the healing process is stopping. It continues to evolve, but it involves in a different environment.
Attending post-op appointments with a specialized physician is crucial in your cardiac rehabilitation.
Having a heart valve placed by traditional surgery, for example, requires a different type of recovery than having a heart valve placed by a catheter procedure in which there are fewer incisions. So we really need to individualize that. The instruction that individuals can get during that time frame is very helpful in identifying what are my personal goals. So they will load those individuals with knowledge so that they are equipped with understanding this is my personal goal, and these are the things that I want to and need to achieve in order to become healthy again.
This has been Making the Rounds, brought to you by Parkview Health.